Today we're going to perform a microneedling treatment on our model. She's looking for the anti-aging effects of the treatment. First of all, we want to start off by examining our model's skin, make sure there's no cuts, abrasions or open lesions on the skin. Next thing we're going to do is sanitize the skin and degrease it. The reason we degrease it with alcohol is to make sure we get out the extra oils out of the skin, so when we put the numbing cream on, it can penetrate really well and make the treatment more comfortable for our model. I do find that the alcohol portion of this treatment is the part that the model doesn't like the most because the alcohol smells pretty strong. So we just clean down the skin. So the next part is the numbing cream. We're going to put numbing cream all over the model's skin. It doesn't matter where you start, but usually I start on the forehead. The forehead is the most sensitive area of the face for the needling treatment because it's the boniest part. And now we're going to leave this numbing cream for about 15 to 20 minutes. We're going to clean it off once again with the alcohol to make sure all of the numbing cream is off. Now we need to have something on the skin to help the needles glide across the skin. So I like to use a pure hyaluronic acid. I don't want to irritate the skin whatsoever, so even though some people will suggest using something with a vitamin C or a vitamin E, we really don't want to do that. Vitamin C is very stimulating and we don't want to take the risk of needling that into the skin and then causing a reaction. So we use the hyaluronic acid, spread it all over the skin. Also, I'm going to be injecting this into the skin, which is going to give her a nice plump and glow after the procedure. And what we're going to do is we're going to glide the needle over the skin. And what it's doing is putting multiple puncture wounds in the skin, microscopic puncture wounds. I like to do a cross hatch across the skin, and that way we can make sure that we hit every inch of the skin, every square inch of the skin. And that we put those puncture wounds in there evenly all over the face. Okay, so one of the many questions that I get is, what needle device do we use? Actually, the needle device that we use, as long as it's a medical device, an electric medical device, it really doesn't matter which manufacturer it is. This is the Cyto pen, which I like a lot. And there's a micro pen, a meso pen. There's lots of different devices. As long as it's a medical grade device and it's electric, then it's fine. One-time use, disposable needles. In fact, I always make sure that I let the patient see that I am opening the needle for the first time so that she knows I'm using a sterile needle for this procedure, because I am going to be penetrating her skin with these needles, and we want to make sure that there is no cross-contamination. So we're looking good. We got a nice amount of pinpoint bleeding on the surface of the skin. So in that blood is the model's own platelets, and then I'm re-injecting them into her skin as I continue to needle over her face. Tonight she's going to feel like she has a sunburn. It's going to gradually start to heat up her skin as that inflammation sets in. So later on tonight she's really going to feel like she has a sunburn, and that's when I advise that you put on a hyaluronic acid or a growth factor after the treatment. That's really going to help speed up the recovery of the skin, and the hyaluronic acid is going to rehydrate and cool the skin down a little bit. So when you take your hyaluronic acid home, you're going to be happy you've got it later, because your face is going to feel like it's on fire. But over the next couple of days we're going to have redness, and then it's going to start to subside. the skin will have a nice plump to it, and that's what people really love, is it has a glow and a plump to it after this treatment. And it can be done once every 4 weeks, and people do tend to like it. It has really great anti-aging qualities, and it'll also really smooth out those acne scars if acne scars is the problem that you're trying to correct. I like to put on a little growth factor. We use the TNS Recovery Serum from Skin Medica, so we put a little bit of that onto the skin. That's going to help it recover quicker. And then finally, a sunscreen.